So it seems the fourth wave is upon us. COVID-19 cases have increased rapidly in the past week or so, driven by the more transmissible Omicron variant identified recently by South African scientists. On the positive front, there is an increase in the vaccination rate. Also, with seroprevalence studies showing over 70% of people in Gauteng alone have some form of immunity, there is hope that hospitalizations will not be as severe as they were in the third wave. Let's speak now to the Deputy Health Minister, Dr. Sibongiseni Dhlomo. Dr. Dhlomo, thank you for chatting to us this Friday evening. The jump in cases, the positivity rate, it has been truly alarming. At this point, do you have any clear indication that our hospitals are going to be able to cope? Are you expecting them to be inundated in a few weeks' time?
Thank you, Ms. Burdett, and thank you to your viewers. Post-third wave, we did not dismantle anything that was to do with COVID-19. Safe to say that our staff members are still a bit tired when it comes to having to manage the disease. However, the equipment, our weekly meetings with AFROX, with regards to the oxygen availability, the dedicated beds that were there, like in the Gauteng province, just on the public sector alone, 4,040 beds and 70 beds are dedicated for that process. So we are seeing increasing numbers of admissions. And this morning when we had a briefing, those admissions are not yet in the ICU, even though our experts are saying to us, as you start with the illness, it probably is not that severe initially, and probably we may see ICU beds being used next week. But for now, we are coping. There's never been any dismantlement of any of our processes that we put in place for COVID third wave.
What about staff, though? You said, obviously, staff are incredibly tired. It's been a rough 2 years. Do you have any plans in place to move staff from one province to another, particularly as we tend to go through our peaks in different provinces at different times?
Unlikely, Ms. Burdett, because right now, while we are still talking about the province of Gauteng, we are already seeing increasing numbers in KwaZulu-Natal, Western Cape, Eastern Cape, all provinces, so you would hardly know where to move your staff to. All we can say that some of our staff members who have been on contract have also been extended, because we are not likely to have this COVID-19 coming to an end soon. So we have extended some of their contracts, all provinces, of course, requesting more support and money from the National Treasury, but we have not had plans to really move staff out of court. All provinces are soon going to be in the same situation that we are finding Gauteng at now.
Talk to me about the placement of junior doctors. This is something that was raised by Professor Mahdi last night, and he says that needs to be urgently sorted out because that's personnel that could be put to really good use. Why is that not yet sorted?
This is the placement of doctors, the interns, the community service doctors. I am very much aware, as I was speaking to the acting DG before the DG came this week, Dr. Nicholas Crisp, that this process was a work in progress as of last week. We know there's an anxiety for the doctors to be placed and soon, but I am actually informed that this is very much the advanced level. It's all doctors, the whole country, all medical schools, and those who train outside the country. So the placement, definitely we need to have them. Besides, it's part of the medical training to finish your 6th year and continue to internship, continue to the community service. So the process is on. I know our doctors out there are very anxious. Yeah. We hope that this is going to be sorted out soon, maybe within a matter of a week or two.
A week or two, let's hope so, because that's probably all we've got if past waves are anything to go by. That's when we start seeing real pressure on our hospitals. I want to ask you about children and COVID. We've had so many reports, so much concern. We know that 10% of COVID admissions in Tshwane are children, I think under 2. I want to ask you, are there more children in hospital with COVID than we've seen in past waves?
I do not have the statistics as yet, but I'm aware we're just having another chat with other GPs, especially with Gauteng, to say, look, this is an anxiety and the concern of parents. My child is a bit having a fever and is just vomiting, diarrhea. So they are admitting some of those children just precautionary. And some of them have actually been found to be COVID-19 positive. But after a day or two, quite a lot of other children have since been discharged because it was that mild flu of a diarrhea and a fever. And I do not have the actual figures, but we are actually noticing that some of the children are being admitted. But a lot are not going even to the ICU. They go into the general ward, being looked after 2-3 days, then they get discharged.
What about in Soweto? Chris Baragwanath, ICU head Dr. Ruda Matiba, telling us on this program that the demographic is changing. The people in their 20s and 30s are landing in hospital with COVID, needing supplemental oxygen. That sounds different. Is she wrong?
Look, you can't argue with Professor Matiba being a deputy minister in offices, because Professor Matiba is at the cold face of Chris Baragwanath hospital. She's actually the head of the ICU in that hospital, and therefore we will also, I mean, as I speak to you now, I don't know how many ambulances are coming into that hospital. She monitors that better than us, but all we are actually saying, as they are seeing those, yes, you are correct, they may be seeing patients with oxygen support needed, but some of them, they are saying, are not necessarily needing ventilation as yet. So you could be in the ordinary general ward oxygen support, not necessarily in ICU. That they are reporting they are seeing in the country, especially in Gauteng.
Are we in the fourth wave in Gauteng, and are we in the fourth wave in South Africa?
Definitely we are. When you look at the positivity rate of COVID-19 2 weeks ago, we're sitting at 1%. Right now, the report was that we're seeing over 25% positivity rate. Therefore, that actually indicates to you that we are definitely on the fourth wave. The numbers have actually gone up very fast, more in the province of Gauteng than the rest of the country. But safely to say, all of us should be at an alert. The country has moved into the fourth wave.
I want to ask you about some possible silver linings, and I guess we're all hoping that this proves to be the case. We've heard early reports that some of the Omicron infections have not been that severe. Could, of course, be due to vaccination or previous immunity. But is there a chance that Omicron is not as severe, that we won't see, while we might see a lot of cases, we might not see as high a hospitalization? Or is it just too uncertain at this point to answer that question?
Sally, we are guided by our scientists in regards to that. But the solace in that and the comfort part in there is that, Sally, this variant, it's a virus, a COVID-19 virus, that is trying to survive, trying to change its structure and form so that it can escape some of the medication, some of the things that we are dealing to it. So part of this Omicron variant has got some remnants of the mother virus or the father or sister virus that we have been dealing with. And therefore, while there is what the scientists are telling us, still to rely on them, our vaccines, there may as well be instances where it is actually escaping the immunity. It's still too early to tell how severe Omicron variant is going to be. That's why they are watching it. But in all these measures, ma'am, we are still saying, please, let's vaccinate, because we now know, and we're getting the figures this morning, even amongst those who are actually admitted, 2% of them are the patients who have already been vaccinated, and the other whooping 98% are people who have not yet been vaccinated. If you are vaccinated, yes, you may still get COVID, you may still get a new variant tomorrow or even next year, but it will not be as severe as it would be to you as if you are not vaccinated, because it is actually still having some remnants of the previous virus or other variants.
That's really interesting. So you're saying that 2% of people who are hospitalized for COVID have actually been vaccinated. The rest are all unvaccinated. And the reason I want to probe that is because we were also told that over 70% of people in Gauteng, according to a seroprevalence study, have got some form of immunity already, be it from a vaccination or be it from a previous infection. But what you're telling me now suggests that the vaccination could it protect you better than natural immunity from getting a previous infection of COVID?
There is no doubt in that the vaccine will protect you. But, okay, let me add, other people, you are correct, can be protected and are protected by having been infected by the COVID-19, got better, and we are now getting a reinfection because we did develop antibodies. Suppose when they get to check them, they might probably find that some of those who have previously been infected and are being reinfected now may still be better off than people who have never been vaccinated and who have never been infected before by COVID-19.
So just clarify for me, are you saying that vaccinations actually offer better protection than a natural previous infection from COVID, or is it unclear?
I'm not at that level to be able to compare and say, yes, it does. But all I'm saying, rather, I will err on the side of getting to be vaccinated. But for all I care, Ms. Burdett, I don't know when I was infected. But even if you were infected 2 months ago and you have a bit of some immunity, there's no harm in going tomorrow and top up your previous infection with a vaccine so that you can have both of it. So I'm not actually comparing reinfection and vaccination. All I'm saying is that the figure we got this morning, that when they look into the statistics, only 2% of the people who are in the wards have been vaccinated. The others are not vaccinated as yet. Probably they have been infected before. So I don't want to compare reinfection and because I think that's too high up for my understanding. All I'm actually saying that we need to vaccinate. Even if I was infected 2-3 months ago, vaccination will still be our safest way going forward.
Yeah, absolutely. I want to read you something that was sent out by Richard Friedland, who's head of Netcare, which of course operates the largest private healthcare network in the country. And he says, if in the second and third wave we'd seen these levels of positivity to tests conducted, we would have seen very significant increases in hospital admissions. We are not seeing that. In our primary care clinics, it's mainly people under 30 years old. I actually think there's a silver lining. This may signal the end of COVID-19, attenuating itself, adapting itself, I guess, to such an extent that it's highly contagious but doesn't cause severe disease. And he points to that's exactly what happened to the Spanish flu. Do you think he might be onto something?
Absolutely, Sally. You remember that me and you were not the first ones to be on the first line for vaccination. We started, they were healthcare workers because they were at a high risk of seeing COVID-19 patients in hospitals. The next lot was those who were over 60 because, again, we actually informed that the age is the highest risk factor when it comes to these issues. We then went down to the over 50 and all that. So, as you are correct, we are seeing this new wave amongst the younger people. And look, on your own, Sally, at your age, you look very healthy and you are unlikely to be real. You can fight the diseases with your own immunity because of being young as compared to a 60 and a 70-year-old. So again, there's another comfort zone. Yes, a silver lining to say if this flu-like illness is coming into the 25-year-old, we are most likely to have a very good prognosis thereafter. But these are the people who are unlikely to really get a severe infections, even because of their own sort of immunity that they carry around as being young. But we still ask them to also go and vaccinate to make sure you top up your natural immunity going forward.
I think what he might be pointing to as well is that not only are we seeing more young people sick because they haven't been vaccinated, but also that a suggestion really that the virus's latest mutation, which is Omicron, has made it very infectious, but possibly less serious. Is it just too early to say?
On the briefing that we had with the scientists, they were saying it's too early to say. Let's give it a bit of a week or two. They will come back to us. Sitting where we are sitting, look, yes, me and Dr. Pasha are doctors, but we still rely heavily on our scientists, our clinicians who are out there and seeing and be able to analyze it clinically and also with research. So we would want to be guided by what they guide us on before we can actually pronounce on some of these issues here.
Yeah, absolutely. We've just got to wait and I guess hope for the best. Deputy Health Minister, Dr. Sibongiseni Dhlomo, thank you so much for chatting to us this evening, confirming for us here on eNCA that the country is definitely in a fourth wave now, and that is due to the rapid rise in cases and also the rapid rise in our positivity rate, and also a commitment from him that in the next week or so they're going to see some action on placing those junior doctors and interns.